Greetings, dear friends. It is a true pleasure to connect with you today. Have you ever found yourself pausing, perhaps after a long day of reading or simply enjoying the view from your window, and wondering about your eyes? Our eyes are truly precious gifts. They connect us to the world, to our loved ones, to the beauty of a sunset, and to the joy of a good book. But as we gracefully enter our senior years, especially beyond 70, our eyes, like other parts of our body, begin to tell us stories. Sometimes these stories are gentle whispers. Other times, they are urgent alarms. For many of us, conditions like cataracts, glaucoma, or macular degeneration become more common. Perhaps you or someone you know has already navigated these paths. These eye conditions are not just about needing a stronger prescription. They can profoundly impact our ability to live fully, to maintain our independence, and to simply enjoy the everyday moments that bring us so much happiness. Statistics, if we look at them, tell us a clear story. Eye diseases are a leading cause of vision impairment and blindness among seniors. This isn't meant to frighten you, but to empower you. Because understanding the signs, knowing when to listen to those alarms, is the first vital step towards protecting our vision and preserving our quality of life. Today, we're going to talk about those crucial eye alarms that, especially for those over 70, should never be ignored. We'll explore symptoms that demand immediate attention, not just for your eyes, but potentially for your overall health. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 10. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. One of the most alarming signals your eyes can send is a sudden, noticeable drop in your vision. Imagine waking up one morning and realizing the world around you seems blurred, or that a part of your sight has simply vanished. This isn't just getting older or needing new glasses, it's an urgent call for help. Sudden vision loss can stem from several serious conditions. For instance, a retinal detachment, where the light-sensitive tissue at the back of your eye pulls away. This is an emergency, and acting quickly can make all the difference in saving your sight. Another cause could be an ocular hemorrhage, a bleed inside the eye, or it could even be a sign of a more widespread issue like a stroke affecting the vision centers in your brain. If your vision suddenly dims, gets blurry, or you notice blind spots appearing out of nowhere, please, don't wait. Don't think it will simply get better on its own. It's time to see a doctor immediately. Our next crucial alarm is severe eye pain, not just a little irritation or dryness, but true, intense pain in or around your eye. Have you ever felt a sharp, throbbing ache that makes it hard to even open your eyes? This kind of pain can be a symptom of acute angle closure glaucoma, a condition where the pressure inside your eye rises dangerously fast. It can lead to irreversible vision loss in a matter of hours if not treated promptly. Think of it as a pressure cooker, building up too much steam without a release valve. Other possibilities include severe infections, like endophthalmitis, which can be devastating if ignored. These conditions are not just uncomfortable, they are active threats to your vision. It's easy to dismiss pain, thinking it's just a headache or I must have rubbed it too hard. But when that pain is sharp, persistent, and located specifically in your eye, it's a sign that demands professional attention. Don't try to tough it out. Your eyes are far too precious. The third alarm to watch for is a red and swollen eye. Now, We all know our eyes can get a little red from allergies or tiredness, but we're talking about significant redness coupled with swelling, especially if it's accompanied by pain, discharge, or changes in vision. This could indicate an infection, such as conjunctivitis or cellulitis, which is an infection of the tissues around the eye. Or it could be a severe allergic reaction that's causing inflammation. Sometimes, it might even be related to an injury you barely remember, or something far more serious. The problem with a red and swollen eye is that the underlying cause can range from something relatively benign to something very serious, and only a doctor can properly diagnose it. What might seem like a simple infection could be a symptom of a deeper, more concerning issue. So, if your eye is noticeably red, swollen, and feels uncomfortable or painful, don't self-diagnose with over-the-counter drops. Seek medical advice. Beyond specific eye conditions, our eyes can act as a window to our overall health. This is a truly fascinating aspect of our bodies. Have you ever considered that a change in your vision might be the very first sign of a systemic illness affecting your entire body? Conditions like high blood pressure or hypertension can cause changes in the tiny blood vessels in your retina, leading to something called hypertensive retinopathy. This might manifest as blurry vision or even sudden vision loss. Diabetes is another prime example. Diabetic retinopathy, a complication of diabetes, often affects the eyes long before other symptoms of diabetes become noticeable. Regular eye exams can detect these changes early, sometimes even before a person knows they have diabetes. It's not uncommon for an eye doctor to be the first to suggest a patient get tested for diabetes or high blood pressure based on findings during a routine eye exam. So, remember, your eyes are not isolated organs. They are intricately connected to your entire circulatory system, your nervous system, and your overall metabolic health. An eye symptom could be the earliest canary in the coal mine, signaling a hidden systemic disease. This brings us to the crucial point, the absolute importance of timely medical care. Perhaps you've heard stories or maybe even experienced it yourself, where a slight delay in seeking help turned a manageable problem into a much more difficult one. For seniors over 70, this urgency is amplified. Our bodies, while resilient, may not heal as quickly, and conditions can progress more rapidly. Imagine an individual, let's call her Sarah, who noticed a sudden blurring in one eye but thought, "Oh, it's just my age." She waited a few days, then a week. By the time she finally saw a doctor, a treatable retinal detachment had progressed, making the outcome less favorable. On the other hand, another individual, Robert, felt a sudden, sharp pain in his eye. He immediately called his doctor. It turned out to be acute glaucoma. Because he acted quickly, his vision was saved. These aren't just stories. They are real-life examples that underscore a simple truth. When it comes to your eyes, especially as you age, don't delay. Early detection and prompt treatment are key to preserving your most precious sense. Now, let's talk about empowering ourselves through daily care and prevention. While we must respond to alarms, we can also work to prevent them. First, and this is simple but effective, try to manage your screen time and reading habits. Give your eyes regular breaks. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. Blink often to keep your eyes moist. Second, nourish your eyes from within. A balanced diet rich in leafy green vegetables like spinach and kale, brightly colored fruits, and foods high in omega-3 fatty acids like salmon can all contribute to eye health. Think of it as giving your eyes the best fuel possible. Third, and this cannot be stressed enough, Schedule regular, comprehensive eye examinations. Even if you feel your vision is perfectly fine, these exams can detect silent conditions like glaucoma long before you notice any symptoms. For those over 70, an annual checkup is a wise investment in your future. Fourth, protect your eyes from the sun's harmful UV rays. Wear sunglasses that block 99–100% of both UVA and UVB rays whenever you are outdoors, even on cloudy days. And finally, if you have systemic conditions like diabetes or high blood pressure, manage them diligently with your doctor. Remember, your eyes are a reflection of your overall health. Keeping your body healthy is keeping your eyes healthy. Dear friends, your vision is a cornerstone of your independence and your joy. It allows you to see the smiling faces of your grandchildren, to read a beloved book, to witness the changing seasons. By understanding the alarm bells your eyes might ring, and by embracing simple, proactive daily habits, you are taking powerful steps to safeguard this incredible gift. Don't let fear hold you back from seeking help. Instead, let knowledge empower you to live a life filled with clarity and light. Listen to your body, listen to your eyes, and always prioritize your well-being. Thank you for joining me today. May your days be filled with clear vision and abundant joy.